This is a 2-minute warning. Reporters on the line, please press 1 to ask a question.
Well, good afternoon, everybody, and thank you for joining today's briefing. Before we discuss COVID, I want to update you on the impacts of Tropical Storm Fred in Western North Carolina. I've declared a state of emergency for this storm and spoken to numerous local officials to offer assistance. Our emergency management team is working closely with local emergency management in Western North Carolina on search and rescue. Approximately 250 public safety personnel are conducting rescue operations by boat and aircraft. Haywood and Transylvania counties were especially hit hard, seeing as much as 12 inches of rain over the last couple of days. Initial unconfirmed reports in certain communities show water levels reaching 3 to 7 feet higher than their previous high water mark. Overnight, approximately 98 people were rescued as river flooding happened quickly, and reports of missing people continued overnight and today. Up to 50,000 people lost power during the storms, and now that number has been reduced to 11,600 people who are still without power. Crews are working to assess damage and get people reconnected. All major interstates are open right now. We do have 6 main road closures and 49 secondary road closures that the North Carolina Department of Transportation is working to assess and reopen as soon as we can. With more rain in the forecast for the end of the week, we know that more flooding is possible. North Carolina is all too familiar with devastating flood events, and we'll continue to monitor and provide support from the state level. Our prayers are with families and businesses that have been affected, and we want to thank everybody involved in rescue efforts and power and road restoration work. I and North Carolina Emergency Management Director Will Ray, along with Transportation Secretary Eric Boyette, will take questions on this at the end of the presentation. But now I want to talk about COVID-19. As of today, we have had 1,131,243 cases, 5,256 new cases reported since yesterday, 2,930 people in the hospital, that number is rising, and sadly, 13,952 people who died. Today, we'll share updates and our state's metrics. But first, I want to announce the final winners of the North Carolina's Your Shot at a Million and Cash for College scholarship drawings. The final winner of our $1 million cash drawing is Lily Fowler, who's from East Bend in Yadkin County. She's in her senior year at North Carolina State University. And Lily, I'd like to ask you to come up and join us. And she's told us she's willing to answer a couple of questions for us. So, Lily, hi. Why'd you choose to get vaccinated? And what would you say to people on the fence who are thinking about getting vaccinated?
Well, I chose to get vaccinated because I was transferring from an early college, and last year, junior year of college, I wasn't able to live in Raleigh, but now that I'm in my senior year at state, I'm in Raleigh. It's a bigger city, more risks, and I decided it was probably time for me to get vaccinated. And what I would say to somebody who is on the fence about getting vaccinated is to it's a personal choice, just do your research with sources you deem reliable, and that's probably all I'd say.
So, Lily, anything you want to share with us about what you might want to do with your prize money?
I'm pretty frugal. I think I'll probably just maybe invest and wait till I'm going to buy a house. However, in the short term, I do want to take my baby cousin Kinsley, who loves Elsa and Mickey, to Disney World when it is safer to do so.
Thanks a lot, Lily. That's a great story about why you chose to get vaccinated, and thanks for sharing with us. We also have our final scholarship winner with us. 15-year-old Breland Dean lives in Garner and is a rising high school sophomore. Breland's a student athlete whose parents will quickly tell you about her 4.0 grade point average. She's here, and she's also agreed to answer a couple of questions for us. So thanks, Breland, for coming up. Breland, if you could tell us why you chose to get vaccinated and what you'd say to people who are still deciding whether they should get a shot.
I chose to get vaccinated because it will protect me, my family, and the others around me to prevent any other spread of the virus. To the people who haven't gotten vaccinated yet and are unsure, I would say that you should maybe take into consideration of how this virus has affected the world, and if you would like to protect the ones you love, please get this virus.
Breland, that's a great message. Anything you might want to share with us about what you'd like to study in school with this college scholarship?
I have not put into any thought of what I would like to study. However, I am leaning towards UNC Chapel Hill to continue my studies.
That's great. Thanks, Breland. We're so happy for you and happy that you and your family chose to get vaccinated and that you'll get this significant scholarship opportunity because of it. Thank you. Our cash drawings have ended, but there's good news. You can still get your vaccine and be protected against this deadly virus. And in many places, you can get a $100 cash card just for getting your shot. And with our COVID-19 numbers getting higher, vaccinations are the best way to bring them down. The vaccines are safe, effective, and free. With the vaccine, you protect yourself from the risk of hospitalization or death. Without it, you're vulnerable. And the statistics bear that out. The vast majority of people in the hospital or dying with COVID-19 are unvaccinated. I recently ordered that state government cabinet agencies require state employees to verify that they've been vaccinated. For those who don't, we're requiring weekly testing and masks. I urged the private sector to join us in requiring vaccines, and I'm proud that many local and national businesses have done just that. Businesses like Tyson Foods are requiring employee vaccinations, and many restaurants and other businesses are requiring them for customers. I think that's good. Today we have Janine Benson from Live Nation Entertainment with us. Live Nation puts on concerts and events across the country, including several major venues right here in North Carolina. They're requiring all of their employees to be vaccinated, and they're taking steps to make sure that concert goers are too. This policy will encourage more people to get their shots. And by doing their part to end this pandemic and creating a safe environment for their customers at the same time, they're helping to keep our economy thriving. I'd like to ask Ms. Benson to share a few words about why Live Nation has implemented this policy. Janine?
Thank you, Governor Cooper, for inviting me here today. Live Nation is committed to finding the best ways for shows to continue and to bring live music back to North Carolina. After almost 2 years apart, it's been truly amazing to see the community reunite as they get to enjoy live music and gathering together again. Bringing concerts back has also given us the opportunity to get a ton of people back to work. We're working to ensure that we are continuing to do the shows in the best way for staff, artists, crew members, fans, and our community. As the leader in Live Nation is implementing a proof of full vaccination or proof of negative test in all of our venues beginning October 4th. We've tried this model at a variety of events, including Lollapalooza, where we saw 90% of fans bring their proof of vaccination and 12% of fans said it was a reason to get vaccinated. Locally, we just did a show at Coastal Credit Union Music Park with the Dead & Company. We saw 70% of fans provide proof of vaccination. It's been great to see that this model has encouraged people to go out and get vaccinated, which is one of the best things we can all do to take care of one another. Thanks to Governor Cooper and Mandy Cohen and the rest of our local and state leaders for supporting our industry through this. We're really looking forward to continuing to bring the magic of live music to North Carolina.
Thanks a lot, Janine. Thank you for showing the type of corporate and business leadership that we need to end this pandemic once and for all. As most of our K through 12 schools prepare to open their doors next week for fall semester, we've seen many North Carolina school districts step up to require masks and other safety protocols for their students and staff. This includes several who've reversed course in recent days and are now requiring masks. I continue to strongly urge all school leaders to make masks mandatory for students, staff, and visitors. Requiring masks in schools will help us keep students learning in the classroom while helping to keep COVID-19 out. We want schools to educate children, not become hotspots for the virus. And I commend the school leaders who are looking out for the health of their students and their staff. I'd now like to ask Dr. Mandy Cohen, our Secretary of the North Carolina Department of Health and Human Services, to share an update on our latest North Carolina numbers. Dr. Cohen.
Thank you, Governor, and congratulations, Lily and Breland. Thank you for sharing your stories and encouraging young people to get vaccinated now. And thank you to Live Nation. I hope employers across the state will follow your lead so we can end this pandemic for good. With our trends moving in the wrong direction, we need everyone coming together to help people get vaccinated. Let's take a look at our latest data. This first graph looks at people who come to the emergency department with COVID-like symptoms. This is our earliest detection mechanism, and you can see when looking at that yellow line, it's been rising rapidly over the month of July and is now much higher than where we were last summer. Next, we look at new COVID cases. This first graph shows you the trajectory of new cases each day since we had our first case in March of 2020. The large peak you see happened early in January before vaccines were widely available. Now look to the right side of the graph and look how steep that line is. We are experiencing the fastest acceleration in cases since the pandemic started. If cases keep This rapid increase is because of the Delta variant of the COVID-19, which spreads more easily than the original virus, leaving unvaccinated people very vulnerable. Our case rates are highest for those 18 through 24 years of age, followed by people ages 24 through 49. These age groups also have lower vaccination rates, which I'll show you in a later slide. Next, we look at the percent of tests that are positive. This graph also goes back to the middle of June, and looking at the yellow line, you can see our percent of positive tests has been above 10% throughout August, and today is at 13%, which is much higher than our goal of being under 5%. With the more contagious Delta variant rapidly spreading, anyone who has symptoms of COVID or has been exposed to COVID should get tested as soon as possible. And remember, we have a treatment for COVID that must be given within 10 days of your first COVID symptom, which makes timely identification that you have COVID even more important. While vaccinations are by far the best protection from COVID-related hospitalizations and death, as well as complications from the virus, the treatment, which is a monoclonal antibody therapy, may reduce the risk of hospitalization and severity of symptoms. But again, the treatment must be given within 10 days of your first COVID symptoms. You can find out more information on about this treatment on our COVID-19 website. On our next graph, we look at day-over-day hospitalizations. This graph also starts in mid-June, and you can see, looking at the yellow line, that this trend has also increased rapidly. Today, we have nearly 3,000 people in the hospital for COVID and 725 people in the intensive care unit with COVID. Last week, North Carolina experienced the largest single-day jump in ICU admissions since the beginning of the pandemic. This trend is alarming. Our hospitals are strained and many have limited capacity already. Hospitals are managing now by proactively scaling back non-urgent procedures and working with one another to transfer patients so that people get the care they need. But this is exactly the situation we've been working to avoid. It is imperative that everyone get vaccinated and wear a mask so hospital beds are there for anyone who needs one, whether it's someone experiencing a heart attack or a car accident victim or someone with COVID-19. This next slide looks at what's happening at the local level, and this is a map from the CDC that shows the level of community transmission in North Carolina. Red is high, orange is substantial, yellow is moderate, blue is low. And unfortunately, you'll see all of North Carolina counties are red with the highest levels of viral transmission. That means everyone in North Carolina should be following the CDC guidance and wearing a mask in indoor public spaces until more people are vaccinated and viral transmissions decrease to at least moderate or low levels. All schools should require masks to keep everyone in school for in-person learning. Last week, Governor Cooper, State Health Director Dr. Betsy Tilson, and I sent a letter to local school boards urging them to fully implement the health protections in North Carolina's Strong Schools NC Toolkit to protect students and staff this new school year. I'm pleased to see that many have rethought masking and are now requiring face coverings. We need all to do so. As we move to look at our vaccinations, there is good news. North Carolina providers have now administered more than 10 million doses of COVID-19 vaccines, and more people have been getting vaccinated over the past few weeks. Our trends would look significantly worse if we didn't have as many people vaccinated as we do now. Today, 56% of North Carolinians ages 12 and older are fully vaccinated. 59% of those 18 and older are fully vaccinated, and 85% of those 65 and older are fully vaccinated. Our last slide today is a new one. It shows the percent of the population fully vaccinated by age groups. As I said earlier, our case rates are highest for those 18 to 24, and as you can see that only 37% of that age group are fully vaccinated. I also noted that we also saw an all-time high for new admissions for children under the age of 18. Only 30% of our young people ages 12 to 17 are vaccinated. Anyone under 12 doesn't have the option right now to get vaccinated. They're relying on us to protect them by getting ourselves vaccinated and wearing masks. If you haven't gotten vaccinated yet, I urge you to do so now to protect yourself, your community, and those who cannot be vaccinated. North Carolina, recent data shows that unvaccinated people are more than 4 times, that's 400% more likely to get COVID-19 than people who are fully vaccinated. New CDC data today reaffirms that vaccines continue to be remarkably effective in reducing the risk of severe disease, hospitalization, and death, even against the widely circulating Delta variant. Nearly all the cases of severe disease line is that vaccines save lives. There's new CDC guidance for people who are moderate to severely immunocompromised. The CDC recommends that if you are immunocompromised and you received either the Moderna or the Pfizer vaccine, that you get an additional dose for better protection from COVID-19. Emerging data suggests that some people with moderate to severely compromised immune systems do not always build the same level of immunity after vaccination compared with people who are not immunocompromised. So in addition, to continue to protect against severe illness, hospitalization, and death from COVID-19, as we head into the winter, the White House today announced that it's planning to support booster shots for the general population. Boosters will be available after September 20th, pending full review by the FDA and CDC. Once authorized, people who receive the Pfizer or Moderna vaccines will be eligible for a booster starting 8 months after their second dose. So we're at a critical point in the trajectory of this pandemic. We have high levels of a highly contagious COVID virus circulating in our state, and hospital capacity is already strained. But we have the tools to save lives and ensure our hospitals can provide care to those who need it. To weather this storm, vax up, mask up, and urge others to do the same. If you're already vaccinated, talk with your unvaccinated family and friends. Share your experience. Help them get accurate information and urge them to get their shot now. It could save their lives. Thank you, Governor.
Thanks, Dr. Cohen. This is not where we want to be, but we have a sure way out: vaccines. Last year, we wondered when this would end and how we could best protect ourselves. The difference now is that we have the most powerful tool against this virus, a safe, effective vaccine. We're putting all of our energy and laser focus on the vaccination effort. I've asked the president to authorize more National Guard help so we can get vaccines to communities across the state. Vaccines are available everywhere: schools, gyms, communities, centers, doctor's offices, pharmacies, health departments. Volunteers are even reaching out to people one-on-one, offering information and rides. It's encouraging that our state's vaccine rate has increased in recent weeks. We need to double down on that progress. Talk with your friends and family about why it's important for all of us to get our shots to protect each other. If you're an employer, join businesses like Live Nation and require your employees and customers to be vaccinated or tested regularly. If you haven't gotten vaccinated, make time to get your shot and talk with your doctor today. And throughout it all, never lose sight of our North Carolina resilient spirit. We can beat COVID for good. As I said, with me today is our Director of Emergency Management, Will Ray, and our Department of Transportation Secretary, Eric Boyette, along with Dr. Cohen, our Secretary of Department of Health and Human Services. Monica McGee and Lee Williamson are our sign language interpreters, and behind the scenes, Jackie and Jasmine Mativier are our Spanish language interpreters. We'll now take some questions from the media who are here in person, and we'll begin with you, Brian.
Hi, Governor. Thanks for the time. I have I'm kidding. I only have 3 quick questions for you.
You've been climbing. That's for sure.
I just wanted to ask to start with, would you sign any budget that would in any way limit your abilities as a governor to respond to an emergency?
So we are in the middle of a public health crisis, and we do not need to alter the Emergency Management Act at this time. I'm going to ask the Speaker and the President Pro Tem to move that provision out of the budget. We hope that they will.
House Bill 805 from Speaker Moore would impose tougher penalties on those who engage in violent protests, but some have expressed concerns about a chilling effect on their free speech or right to assembly rights. I'm curious where you stand on this issue and if you plan on signing it if it gets to your desk.
Well, we should not have riots, and people who or take part in riots should be prosecuted. That needs to be said first. But also, we've made significant proposals about racial equity in the criminal justice system and some important common sense changes that need to be made. And that bill doesn't include any of them. So I have real concerns about it, particularly when it's by itself without these other issues that the legislature has been discussing. So I will review that legislation. I'm going to talk with legislative leaders. We need to tackle the racial equity issue in the criminal justice system.
And last one, just with regard to some of the graphics that we saw earlier in the presentation, North Carolina's map is completely red right now. 6 months ago, masks were required statewide and they were required in schools. And now we're seeing the worst levels of all available metrics in the last 6 months. Are you open or are you actively considering reimposing these mask mandates for schools and the general public?
We're going to continue to put the health and safety of North Carolinians first, and all options remain on the table. However, we are at a different point in this pandemic than we were before. We have effective, safe vaccines. So many people are continuing to get vaccinated. We know that's the way out. People, businesses, schools know what to do with masks and safety protocols. And many of them, more and more every day, are adopting them. We're getting more and more local buy-in on doing the things we need to do to protect people. So right now we're going to focus our energy on vaccinations, but all of the other issues are there and available for us to use if we need to. Yes, sir.
Hi, Governor. I had a couple questions related to masks initially. We've seen here in Wake County, some cities and towns are adopting mask mandates, some are not. As you mentioned, some of the schools are, some aren't. Is this piecemeal approach really an effective way to deal with the surge that we're experiencing right now?
Well, as I said earlier, people know what to do to protect themselves. And what we see is, I think, mandates at a local level are more effective because there is more buy-in and a better way to enforce. I'm particularly concerned about masks in our schools, particularly with children that can't even be vaccinated yet. But I am encouraged by the fact that system after system is rethinking this. We're going to see some more in the coming days of schools that are getting the buy-in. Already we have, I think, over 75% of students in North Carolina right now are covered by a mandatory mask mandate. We hope that that continues to rise, and we encourage local governments to take action to protect their citizens.
And if it is that you want the schools to mandate masks, why are you still so reluctant at this point to just tell them you have to do this?
Well, first, I think you get more effective buy-in when it is done at the local level and decisions are being made at the local level, particularly now with all of the knowledge that we have. And I know that Dr. Cohen, Dr. Tilson, a lot of our medical providers have been on the phone with local elections board. They're educating them on this. They're becoming more and more receptive for the need to do this. I think it's a better way to do it right now.
And then one last question related to the booster shots. Can you give us an idea of what preparations you all have made and what that process is going to look like? Is it going to be different than the first time around? Mass vaccination sites? Are we going to see that again? Kind of give us an idea of what this is going to look like in the next several months.
We are ready for the third shot for those who are immunocompromised, and we are ready for the booster shots when they come. We're going to be ready to be fully operational, but I'm going to let Dr. Cohen address that specifically.
Thanks, Governor. And so let me reiterate, for those who are immunocompromised right now, they could go to any of our vaccine sites and get the additional dose if they are immunocompromised. What the White House announced today is coming in September, but no sooner than September 20th. There's going to be likely an availability for a booster shot, meaning a third dose of that same vaccine, either Pfizer or Moderna. I think we are still looking for additional guidance from the CDC and the FDA. How are they authorizing it? Are they going to do it for certain age groups or certain subsets of populations? We will be ready for all those permutations. I think we're in a different place than we were at the beginning, where we have a much more robust pharmacy program in terms of being able to vaccinate, as well as doctors' offices now all have I shouldn't say all. We are encouraging even more of them to get vaccines, but more doctors' offices have vaccines. And so we have more access points. So I think we're going to be really rethinking over the next couple of weeks as we get more guidance from CDC and FDA. How should we think about getting ourselves ready for those third booster shots? But we have a lot of different permutations. Already been on the phone with our vaccine providers, asking them how do they want to scale up. I would say this is one of the places where I am concerned, because at the same time we're asking our same vaccine providers to do more. We're having these surges in our hospitals and seeing our frontline healthcare workers get pulled to take care of very sick folks in the hospital. So we definitely have a lot of work ahead of us. And that's why we need everyone to get vaccinated right away, as well as wear masks, get tested, and do all the things we know that can slow the spread of this virus.
Thank you.
Thank you.
Jonah.
I have some severe weather questions. So if Director Ray wants to come up.
Sure. We'll recognize Will Ray, our Director of Emergency Management.
Use a COVID break. I'll come back though. Director, we'll start with this. When people think of flooding and these severe weather events, normally, especially this time of year, we think of the coast. What are the unique challenges of this happening out west? In particular, what happens with mudslides and different things like that? And what are we learning about conditions on the ground?
So thanks, Jonah. First, I will say we are so fortunate to have the partners that we do in our local jurisdictions in the western part of North Carolina. We are fortunate to have the partnerships that we have in the state emergency response team, and could not be more proud to work with the public safety professionals that we do. As the governor mentioned, we have over 250 personnel in addition to ones that were sent via mutual aid county to county that are in Western North Carolina right now to provide that critical assistance, and are just incredibly thankful for all of them and their agencies, and just want to say thank you to them right now. Certainly over the course of the day yesterday, we saw the threat change very rapidly. Water began to rise very quickly and caused some of what you mentioned with some of the landslides, some of the damage to roads and other infrastructure. And so I think our major concern was flash flooding. And so that is the reason that we put the resources in that area of the state that we did, particularly for swift water rescue. They are continuing to operate today, doing surveys, wide area search, as well as continuing rescues for individuals that are in structures or are somehow cut off from main roads. So it is still very much active response is ongoing there. And we are committed to stay there as long as that part of the state needs it. As the governor mentioned, the bulk of the impact right now does seem to be in Haywood and Transylvania counties. And we will continue to put support from the state emergency response team in Western North Carolina as long as it's needed.
What are the challenges in terms of getting to places? You know, it's tough to put a boat in the mountains. So how do you get to people? I heard that, and there are reports of, first of all, like 30 people still missing or unaccounted for, kids who got to school, couldn't get home.
Correct.
What do we know about that?
So I think, again, as Secretary Boyette and his team with DOT have done a really great job keeping our major interstates open. We do have all major interstates are open. So we do have some thoroughfares into those impacted communities, either via ground, water, or via air. We have a number of resources from the National Guard and the State Highway Patrol that are, and Civil Air Patrol that are in the area operating to be able to move either resources or people or move them out of harm's way. Those are conditions that will change as water ebbs and flows, and would again remind folks to be cautious and aware of those conditions on the ground. That's why it's going to be important to follow local guidance of public safety officials about any orders for evacuation.
Last thing about severe weather is this is for many people the last week of summer vacation. People go to the mountains. If they have plans this weekend and we have more rain in the forecast, what should they be doing with those plans?
We do. I think folks need to first, I think, make sure they're getting reputable information on the weather from reputable sources. Make sure you have multiple methods to be able to receive information and any alerts for the area that you're traveling to, and stay closely connected and look at the forecast for the area that you're going to. As you mentioned, we are going to see scattered afternoon and evening thunderstorms today through the rest of the week. We could have some additional localized thunderstorms that could cause some flash flooding in areas later this week. I think the other item that we're continuing to look at is Hurricane Henri, which at the latest model run shifted slightly further west. It's still several hundred miles off the coast, or forecast to be several hundred miles off the coast of
We've seen that. I'll have to fact check myself, but I think the last time we saw every county being red was probably when we were in phase 2. Garth Brooks announced today he's canceling a concert in Charlotte. We had Michael Bublé cancel a concert, reschedule a concert. Although now we have someone here talking about concerts going on in Raleigh and other Live Nation places. I guess, what are people supposed to take from this? Because on the one hand, we're seeing how dangerous it is and all these hospitalizations. On the other hand, we're promoting concerts today safely. So what should people do moving forward? How should they approach this? And how should they live their lives with this balance?
Sure. I think it's a really good question. And most important is that folks need to get vaccinated. We continue to see, and the CDC put out even more data today to show that vaccines protect folks from getting severely ill, from getting hospitalized, and from death from this virus. So vaccines are our number one tool. And 6 months ago, we didn't have those tools. So when we saw these kinds of levels of viral spread in the past, we did not have widely available vaccines. Now we do. You can go into any one of the pharmacies across North Carolina to many, many different vaccine providers, get a vaccine today. We also have treatment, which we didn't have before, which is also widely available, not just in infusions, but now can just be administered in a doctor's office. So that's good. So we're at a different place. We also have testing that's widely available. We know so much more about masks and what masks can do to protect us. We need to layer protections now. We need to get vaccinated. We need to use masks. We need to make sure if you are having symptoms to get tested. We need to use our tools. And that's why we can safely make sure our kids are going back to school. We can make sure that events at Live Nation can happen safely when we use these layered protocols, but we have to all do them together, right? It's always been a joint effort since the beginning of this, and it still remains. We need to get vaccinated, protect ourselves, and to protect everyone around us. We need to wear masks to protect ourselves and those around us. We need to get tested, need to use treatments. I think if we do all of these things, we're going to get through this. It is a different moment than before, but we have to learn the lessons from before that we, through these 18 months that we've worked hard together and keep getting vaccinated and doing the things we know can protect each other. Thank you.
Actually, stay with Dr. Cohen to start with. Matt Mercer, North State Journal, as cases have increased, goes along with that, the number of folks who recover. Over 1 million North Carolinians have recovered from COVID-19. So my question to start is, what is being done to kind of track the level of natural immunity that folks have? And why do those folks also still need to get vaccinated if they have successfully recovered and still possess antibodies from COVID-19?
Yeah, so there's a very different way in which your body builds immunity when you get COVID and then you build immunity versus when you get a vaccine and you build immunity. Vaccine is a supercharged way of teaching your body about COVID and all different kinds of COVID. When you get COVID just naturally in the community and you've gotten sick with it, it potentially can just give you a limited type of immunity. Some people it can give an extensive immunity, but often it can give you limited immunity. And we are seeing plenty of folks, unfortunately, who are getting COVID a second time. What we are seeing now, and the CDC announced this today, is even when you have a vaccine, while it is still protecting you against severe disease and death, we are starting to see some lessening of protection of that vaccine over time. The same thing happens if you had COVID a year ago, your immunity could wane, meaning lessen over time. Getting the vaccine really teaches your body to recognize COVID in all of its forms and protects you from severe disease and hospitalization. That's why it's really important, whether you've had COVID or not, to get vaccinated right away.
And to go along with that, so those antibodies, what has the state been doing and what will the state continue to do to track, that percentage of the population that does possess antibodies, both from vaccinations and from natural immunity?
So I think we don't have enough data to know whether truly just tracking antibodies in and of itself tells us enough about whether or not you are protected from getting COVID in the future. Our immune system works through a lot of different ways. One of them is with antibodies. Others are T cells or B cells. And I think the scientific community is still trying to understand what is that marker that we want to be tracking over time. Is it antibodies? Is it T cells? Is it something else to make sure that we have continued protection? Right now, what we're able to do is look at natural studies, and the CDC released 3 of them today. One about what was happening in New York, one in a long-term care facility. So we look at these studies to help inform us to know how is our immune system working and responding to COVID. Right now, what we know is that these vaccines are remarkably effective at protecting us from getting super sick, getting into the hospital, or dying from COVID. And that's my message today. Vaccines save lives, and you got to get vaccinated as soon as possible.
All right,
Thank you.
thanks. And Governor Cooper, I do have one question for you. As I'm sure you've seen across the state, there are parents who, see their school boards voting to make masks mandatory, and they feel like that choice has maybe been taken from them. So just kind of broadly, what do you say to those parents who feel that way?
That masks save lives, that when we're requiring school children and staff to wear a mask, we're protecting people who don't even have the choice to get a vaccine because they are too young to get one. So this is probably one of the most important things we can do right now in mask wearing to protect the public, protect our children in school.
And so just to kind of follow up on that, this is the last one, I promise. So if those parents, and this has been going on, you kind of see it on Facebook and other places, parents are going to pull their children out of public schools, or they're exploring other options. Do you feel that that's a valid response, or what do you kind of say if they say, well, I'm just going to pull my kid out of their public school and find another option to educate my child?
It probably one of the most important things in your life is your children. And I know I feel that way, even though my children are adults now. So this is a very emotional thing. And, even a parent who feels strongly about masks one way or the other, I respect that love and caring for their students. I would just urge parents to listen to doctors, to look at the CDC, to see all of the evidence that is there that their children are going to be protected more in a school where children are wearing masks. And I hope they will stay in the public schools. We want them to. I certainly know that there's probably a danger if in schools that are not requiring masks, that some parents who want to make sure they're protected may leave the school because all the children and staff aren't wearing masks. So this is the science is clear, the evidence is clear that we need to do this. And I hope that parents can come together with local elected leaders and do what we need to do to protect our children in school. Yes.
Governor, I'll just stay on school since we're on the topic. You mentioned one reason for not having a mandate for schools is because you want to give local control and you believe that the vaccines are out there. But the reality is that kids under 12 cannot get vaccinated yet. We have heard from parents in these districts who are making masks voluntary, who say they feel that the school board is not putting safety first. They're disappointed. So do you feel that you not implementing that mask mandate for schools, that parents should feel disappointed in you and the state as well?
Well, first, we're over 75% of students who are now covered by a mandatory mask mandate. And we believe more and more school systems are going to be coming online because of the conversations that they are having with doctors and medical professionals. I want to make sure that our children are safe in school. And what I think we are seeing is that there is more buy-in and better enforcement when these decisions are made at a local level. And we're continuing to see that. I will say that all options remain on the table. So we're going to continue consulting our medical professionals and see how the school year goes, and all options are still available to us.
I'm going to use Harnett County as an example in our area. They still have masks voluntary. If there is a widespread outbreak in the first few weeks of school, do you believe that you should take some responsibility for that?
Well, first, I hope and think maybe that Harnett County may be changing their mind. We'll see how that works, because we've had a lot of conversations going on. We're all in this thing together, and we all need to work together to act responsibly to stop this virus.
Thank you. My next question was for Dr. Cohen, if I can, and this is about the uniform statewide mask mandate. I know given the rise in cases and obviously this virus has no border, just a yes or no, would you support a statewide uniform indoor mask mandate?
So we are already, as I mentioned earlier, recommending that everyone, regardless of vaccination status, wear a mask when indoors in public settings. So we are already recommending that. And what I see is a belt and suspenders of local authorities mandating that for public spaces. We very much support that, and I think that is going to continue to help us to slow the spread of the virus. So we are already recommending statewide that all folks here in North Carolina wear a mask indoors in public settings. We know what works. We have the tools. Let's use them. And I don't want to forget the fact that we still have too many people who are unvaccinated. And so our focus continues to be on getting folks vaccinated.
Today, the CDC, this question would also be for you, mentioned that they are working with 16 states, their COVID surge task force. Is North Carolina one of those states, and how are they assisting you all right now, if so?
I'd have to go back to my team on that. We obviously work incredibly closely with CDC, so I'm not sure on that point, but let us go back to our team and I'll follow up with you.
And my
Thank you.
last question was for Director Ray on the weather. We were hearing just before this meeting out of Haywood County that 30 people were unaccounted for. Do you have a total across that entire region, how many people they are searching for?
So as I said, we have seen some reports of individuals who are missing. We know there are some coming out of Haywood County as well as some other counties. Those have not been reports that have been substantiated or confirmed at this point. I do want to stress, as we said earlier, the operation is continuing right now. They are still very much in response mode. They are still searching structures. They are conducting the wide area search. They are continuing air reconnaissance. They are continuing the work by our Swiftwater teams. And so we know that we are continuing to identify homes and identify people that need support, and anticipate that there will be potentially some of that down the road. But right now, the team continues to focus on continuing active rescue operations at this point.
And just one more question for Dr. Cohen. Last week, that letter to schools was sent to, I believe, 56 school districts that had voted to make masks optional. Do you know how many have reversed course and how many we are dealing with across the state that are still voluntary as of today?
Yes. So as the governor mentioned, we believe 75% of the students are covered by a mask mandate. Since sending that letter, we believe 12 or 13 school districts have in fact, re-looked at this, taken a different vote, and decided to go with a mask mandate. I'm grateful for them working with us. We have continued to work with additional school districts, and the governor has said we anticipate even more moving towards that mask mandate, in addition to the other safety protocols that are in that. So already seen 12 or 13, expect to see more over the course of this week. Thank you.
Thank you so much.
Dawn?
I've whittled down my list. Dawn Bauman, the News and Observer. Questions about the budget and vaccinations. I'll start with the budget. Now that we're in the conference process, are there provisions that are deal breakers for you, or things that you'll really, stress when you, assuming you are meeting in person or however with Berger and Moore before they pass that final budget?
All options are on the table. There's not any single issue that would have me enact a veto or to sign the budget. It's going to be a combination of those things. We want to see the policy issues. There are a number of policy issues that would take hours and hours of meeting time and many amendments to try to get right that really ought not to be in the budget. And you can see from my budget that we want to invest more in education, in educator salaries. We want to expand Medicaid. We want to make sure that children have a sound basic education. So those are my priorities, are pretty much out there and have been for a while. And I think the leadership knows that. So we're hoping to find some accommodations. We're going to work toward getting a budget at the end of the day, but with the idea that we're not going to enact a bad budget, and we'll veto it if we have to, but we want to try to find a way forward here.
Are you going to meet with them before the conference budget comes out?
So we've been talking, and you've got the Senate and the House have very different budgets and very different ideas and a lot of disagreements. So we've sort of gone back and forth about when I would enter the process. I think that they're going to try to get some agreements amongst themselves on literally hundreds of issues that are involved in this budget and in dispute. The key thing is that they're going to let me and Senate and House Democrats actually see the budget before they roll it out and vote on it. Also understanding veto a sign based on a budget that I've really not had a chance to see or have any input in. And I think that we realize that that process didn't work last time, and it needs to happen this time. So I think it'll be a little fluid as to where we are already. Dr. Cohen's already talking to legislators about issues in health and human services, and we're continuing those conversations.
And then on vaccinations related to, state versus local with, mandating it or having the weekly testing for, most state employees. What about teachers and those that work with children that aren't old enough to be vaccinated yet? Is that something that should be mandated at the state level, at the local level?
So we want to encourage all people to get vaccinated, particularly teachers who work with students. I know that we're going to continue to work with the State Board of Education, with the superintendent of public instructions, with the local systems that employ these teachers and are making decisions about that. We put them very early in the process when we were making decisions about how to prioritize people. So we've sent the signal how important it is that we believe that educators should be vaccinated. We're going to continue to push that issue.
But nothing where any sort of, mandate of vaccination versus
all
regular
options
testing.
are going to continue to be on the table, but no, not at this time.
And then for Dr. Cohen, you mentioned the booster. There's nothing on the J&J booster, which I know that you got. Lots of people are wondering what are they going to be able to do and look for once they hit that 8-month out mark.
Yeah, so the CDC and FDA announcement today was specific to the Pfizer and Moderna vaccines. They did mention that the J&J vaccine, they're looking for additional data that they hope to come in the next couple of weeks. So I too will be looking at that data very closely. But what we are seeing with the boosters is that you wouldn't be eligible for a booster until at least 8 months after you finish your series of vaccines the first time. Johnson & Johnson, as you know, was not authorized until the month of March. So again, from a timing perspective, they still have a little bit more time to gather more data. So I think jury is still out. Scientists are still working in terms of understanding the J&J and what will happen in terms of boosters with those.
You mentioned layering with safety. So, and that if it's 400% more likely that you're going to get COVID if you're not vaccinated, what's the risk factor for the already vaccinated people? Like how should they, how worried should they be? How should they adjust things? Are masks as important for them as unvaccinated? Is it part of it just being everybody?
So, well, a couple of things to tease out from your question there. First, I would say that vaccines continue to show us that they are incredibly effective at preventing severe disease, hospitalization, and death. And the new data just put out from the CDC today continues to reinforce that. So for people who are vaccinated, they should feel protected from the worst of what COVID could bring. So that's great. But what we are seeing is that it is still possible for you to get COVID even if you've been vaccinated. It is much more rare, but is possible. And particularly for those of us, and I'll speak for myself, who have 2 children under the age of 12 who are unvaccinated, right? I think there are different decisions for different people. Some may live with folks who are immunocompromised or at higher risk. And so I think folks need to know that we have the tools available. They know what works. And so what I would say is make sure that you are tailoring your layered protection to your personal circumstance. I wear a mask as a CDC recommends in all indoor public spaces. I follow the Raleigh new mask mandate. But I'm also very particular because my children are unvaccinated to make sure that we are taking even more protocols because of that. And so I think that every family, every person needs to think of that. And I think that everyone needs to remember the fact that we're all in this together. And all of our actions influence our friends, our neighbors, our community. And that's why layering protection is really important. Vaccines work, they're safe and effective, but masks are also necessary at this moment when there's so much virus here in North Carolina that's unfortunately very contagious. Thanks.
Thank you.
And we'll see if we have any remote. I know we have some people on the line. So if you can identify yourself and your organization.
Question is from Tyler Fleming with Spectrum News.
Hi, Governor. This question has to deal with what we're seeing in the western part of the state. Flooding continues to harm our state just weeks after a UN report outlined startling climate predictions and updates. In light of these developments, do you feel the amount of money being invested in infrastructure for flood and climate change mitigation in the state matches the threat currently being proposed by it?
No, we need much more investment in resilient infrastructure. And as we build back after storms, we need to think about the future storms that are coming. We know that climate change has affected the ferocity of these storms, and we're just seeing it every month that goes by of things that are happening not only in our state but across the world. So as we rebuild, we need to be more resilient, and we need to invest more in resilience. And it's one of the reasons why I'm strongly supportive of the bipartisan infrastructure deal that has been struck and voted on by the Senate. I hope that we can get it out of Congress and signed by the president. We have our North Carolina Office of Recovery and Resilience. We are working on resiliency issues. We must put more emphasis on that. Next question.
Our next question is from Tess Bargerber with Fox 8.
Tess Bargerber, Fox 8 here. Thanks for taking my question. Nearly all of the health departments here in the Triad say they're wanting to ramp up contact tracing teams with case numbers going up right before the start of the school year. Will the state be able to accommodate all these requests for more tracers?
We want to increase the number of contact tracers, and I'm going to let Dr. Cohen address that issue.
Hi, thanks for that question. We're obviously working hard to make sure we have the resources in place. We've learned a lot of lessons, as well as put in some additional protocols to help use text messages and other electronic means of communication and doing that contact, so that we are able to lessen the burden on our contact tracers. But we are working to fulfill all of those requests. Thanks.
Next question, please.
Our next question is from Laura Lee with Carolina Public Press. Good afternoon, Governor. Laura Lee from Carolina Public Press. We've talked a lot about mask mandates for schools. We haven't talked as much about CDC recommendations for school testing. And I know you have an opt-in plan where I believe about 52 of the LEAs have opted in, but some larger districts have not. And we're hearing from parents that are saying there's no testing protocols for students who are already back in school for year-round. So I'm wondering what programs you have for testing, and what do you say to these parents who are concerned that there's not sufficient testing in their districts?
We're encouraging testing and want to provide the resources for that, but I'll let Dr. Cohen talk specifically about it.
Hi, Laura. There's two forms of testing that we're offering completely free to our school districts. One is making sure they have access to rapid tests right on site at all of our schools. So that we want to make sure happens, as well as access to a school nurse. So that has really, there's been a lot of wide uptake of that. So I can get you the exact numbers from our team in terms of the number of school districts that are doing on-site testing for symptomatic folks. So meaning they come to school, either a teacher or a student with symptoms of COVID, and being able to do a test right in the moment. One, I think it cuts down the amount of time between knowing if that student is positive or not, but also helps in terms of quarantining and other kinds of protocols that need to be put in place. The other is on screening testing, meaning routine testing of a certain population on a routine basis, whether that's teachers, students, or both. That is also available for free to every school district working with the state. There have been a number of school districts. I do believe that the number is higher than what you mentioned, and our team, I can get you the exact number. But we hope more school districts do opt into that testing. Again, it's layered protocols that I think are important here. Vaccines, masks, testing, the quarantine procedures, all of these things layer together to help protect our students and keep them in our classrooms learning and safe. So we're going to continue to work with school districts to make sure that they know the options that are available to them and encourage them to take advantage of that.
Next question, please.
Follow-up, Laura Lee, Carolina Public Press. Thanks for that. My follow-up is actually about monoclonal antibodies. And I'm just wondering, and we were talking about that as a potential treatment for people who are already infected with COVID. Do we have sufficient supply of that? And is there equitable distribution of that across the state such that anybody in any part of the state would be able to access it?
Laura, Thanks for that question. So the short version is yes, we have access to monoclonal antibodies. It's available in an infusion as well as just an injection. So now we are actually able to administer these treatments in more spaces. Before, you really had to be in a place that could allow for an infusion. Now that it can be done as an injection, it can be available in more locations. We are looking to make sure that there is access in wider places across North Carolina. If anything, we have seen low usage of the monoclonal antibodies, and we want to make sure folks know that it is available. I want to make sure folks who do get symptoms of COVID to get tested right away, because those monoclonal antibodies have to be used within the first 10 days of you having symptoms, and the earlier you use it, the better. So it is really important. So what I would say is get tested soon if you think you have symptoms of COVID. If you have COVID, get in touch with your doctor and make sure that you ask about this, particularly if you are older or have underlying medical conditions. But yes, we have access to the antibodies now that it's available in just a shot, an injection. We can give it in more locations, and we're working with providers to make sure that access is available widely across North Carolina.
Next question.
Our final question that will conclude today's press briefing is from Rose Hoban with North Carolina Health News.
Hi, folks. Thanks very much for taking my call. It's Rose Hoban with NC Health News. This was going back to your executive order for people in cabinet departments to, get like correctional facilities. Some of them are in pretty rural areas. So, you might have a database of folks who are vaccinated, but how are you enforcing the masking?
Well, immediate supervisors would be carrying out the rules that are put forth by the Office of State Personnel, State Human Resources. We are working closely with all of the cabinet agencies to, number one, make sure that we have a process for verifying the vaccination, and then we don't have to worry about it. But if they don't verify, then we do want to make sure that there is testing, and we want to make sure that there is masking, and supervisors will be responsible for making sure that's done. They're also working through protocols on what are the consequences for employees who just simply are not going to get tested and not going to wear masks. And we want to be together on that. So we're still working on what the ultimate discipline could be for that. The idea here is to get people vaccinated, and we're using this period of time to work to talk with people, to hear their concerns, and to convince them to get vaccinated. Dr. Cohen, would you want to add to that? Okay. So follow up, Rose?
Yes, I do have a follow-up. Thank you. It's about verification of vaccination. We did a story about how to get your verification off of the state website. Well, it turns out that, for example, I went to a pharmacy and the pharmacy doesn't have my verification. And my husband went to a community health center and oops, they didn't upload things they didn't upload his email address, so what are going to be the alternatives for folks whose vaccination verifications are not in the state database?
Rose, thanks for that question. So first, I would say that the vast majority of North Carolinians have gotten their vaccine at a North Carolina provider. That means their information is accessible and they're able to easily download it. Now, if you got it at one of our federal partners, meaning at Walgreens or CVS or another pharmacy, each of those have their own portal in which you're able to access your own vaccine record. And that's what we just want to make sure folks are able to access their own record. So if you got it with a provider in North Carolina that's not a pharmacy, you can access it through the North Carolina portal. If not, then as I said, all of those pharmacies have their own individual portals for you to access that information. I know that there are a number of places that are working with community health centers and others to facilitate their ability to make vaccine information easily available to those who have gotten it. So we're working with those and happy to support. Again, that's, I think, a national effort that is going on right now. Thank you.
Thank you all for joining us today. If you hadn't gotten vaccinated, do it. Thank you very much.